Welcome to AiArthritis Voices 360, the podcast solving today's most pressing issues in the AI arthritis community. We invite you all to the table, where together we face the daily challenges of autoimmune and autoinflammatory arthritis. Join our fellow patient co-hosts as they lead discussions in the patient community, as well as consult with stakeholders worldwide to solve the problems that matter most. Whether you are a loved one, a professional working in the field, or a person diagnosed with an AI arthritis disease, this podcast is for you. So pull up a chair and take a seat at the table.
Welcome to AiArthritis Voices 360. This is the official talk show for the International Foundation for Autoimmune and Autoinflammatory Arthritis, or AiArthritis for short. My name is Leila P.L. Vallette, and I am your host for this special episode today. I'm a person living with lupus and Sjogren's disease and am the health education manager here at AiArthritis. And today is our very first episode of 2025. And we will be sharing highlights from our most listened episodes of last year in 2024. So let's start out with our number 3 clip. Our number 3 clip is from episode 98 from June of 2024, Mental Health with AI Arthritis Diseases. Our co-hosts, Juana and Estela Mata from Looms for Lupus, discuss how mental health can be affected when someone has an AI arthritis disease and different techniques that can help.
You know, when we're talking about this, we're not talking just about the individual about coping mechanisms. We're talking about also coping mechanisms for the caregiver and the families and the loved ones. You know, when we're looking at the impact of autoimmune diseases and or AI arthritis conditions in the United States, there are about 5% to 8% of the U.S. population that are diagnosed with autoimmune diseases. That's a lot. That's pretty high. And so when we're looking at the big picture, it's like, let's talk about the impact of autoimmune diseases and AI arthritis diseases and the impact that it has on our mental health, right? And let's talk also, and you just shared a little bit about a couple of coping mechanisms that you use, but the next thing that I want to talk about is just different strategies that we can utilize when we're coping with autoimmune and or AI arthritis conditions, right?
Estela, before we go into that, I really want to also focus on, this autoimmune conditions or AI arthritis conditions is not only affecting the patient, it's also affecting the caregivers and loved ones. So it's very important for us to help our caregivers and our loved ones incorporate all these techniques, because the patient is not the only one that's affected. So we want to make sure that, all these techniques are also practiced not only by the patients, but also by the caregivers, loved ones. And mental health is not only affected because we're going through these changes in our bodies, but our caregivers looking at us and not knowing what's going to happen with their loved one is also hard for them. So definitely a caregiver is affected.
Yeah. And I think that's it's the unpredictable, right? It's these flares that these autoimmune diseases or AI arthritis conditions cause, and not knowing, how bad they're going to be, not knowing when they're going to come, not knowing how it's going to impact our daily lives, how it's going to impact our loved ones, how it's going to impact our physical lives as well, how it's going to impact our love life, our marriage life, our life just in general. And I think that is the stressful part of it, is the unknown, right? The unknown of the impact of the flares, the unknown of the impact of this disease. So I'm with you. One of the reasons why when I first started the podcast, I talked about me being an advocate for for care partners and loved ones. I put that first because that was really my role. And also understanding that our role does change throughout the process. When we first started advocating together, we advocated as the sisters. You were living with the autoimmune diseases and rheumatoid arthritis and arthritis conditions, and I was there as a supporter. I was there as a loved one, as a caregiver. And now, as of last year, I now was also diagnosed with rheumatoid arthritis. And that has shifted a lot of things. And, for those of you that don't know this, it is so difficult to know that you could be the best advocate for someone else. But when it comes to you and you realizing and accepting your condition, it is a whole other ball game. And I have been struggling with it. I have been struggling with it since December when I was diagnosed with rheumatoid arthritis. Not many people know that I do live with rheumatoid arthritis. And that is why I wanted to talk about this, because, we transition into different roles in our lives. We are healthy individuals. We are loved ones and care partners to someone that lives with an autoimmune or arthritis condition. And then we may also be the patient as well, and give ourselves the opportunity to accept those different roles. Give ourselves the opportunity to learn about the conditions, and give ourselves the opportunity to go through those grieving stages on when you are diagnosed. So we always say this: it's important for you to learn about your condition. It is important for you to learn about how to take care of your bodies and yourselves, and then learn about how to communicate with your care providers, with your care partners, and with anyone around you, right, that you're dealing with. But most importantly, practice self-care. Practice to learn about how to take care of yourself. And with this next topic, yes, I want to talk about different ways that we can prioritize our mental health, different ways that we can use, and different things that we can do to help ourselves. And so you gave an example, Juana, about setting yourself as a priority in self-care.
Right.
What do you do when it comes to physical activity, regular exercise? I know you're dying to give us a couple of tips. I know you do. So self-care is prioritizing physical activity, regular exercise, reducing stress, and also eating healthy. So what do you do, or what tips can you give us about that?
Well, before I give you or I share what I do, because we're all different. We're all different. And not because I talk about doing certain things that help me means that everyone is going to be able to do them. But one of the coping strategies that I always talk about is understanding your limitations and boundaries, and, understanding the changes that your body is going through, and especially with lupus and rheumatoid arthritis, there's going to be so many similar things and there's going to be so many different things, but you have to understand and listen to your body. And you also have to learn how to say no when you know you can't do certain things. But one of the things that I like to do is I like to always focus on something else. I like to be positive and, being grateful every morning I wake up, because waking up is already something that, in my opinion, is very positive. I'm healthy. I'm alive. I'm breathing. I'm here today. So being positive is one of the things that I always, practice, staying positive, even if things are not going the way I want them to go. I have to stay positive, practicing gratitude. And of course, doing things for my body, like exercising. And it doesn't mean that I'm going to go to the gym and lift weights. It means that I am going to do what I can do. Sometimes it's just taking a few steps. Other times means taking a run. But again, we're all different, and we always have to do things that we can do.
Yeah. So as far as physical activity, what do you do when you're feeling good? What type of physical activity do you do?
I like to walk, and I like to, I have a bike, a stationary bike. So I do bike. I have a stepper. So I do steps on my stepper. And I also like to, now I started incorporating, I have a vibrating plate that for me, it has helped me with my blood flow. So that's something that I do. But again, not everyone has a stepper or a vibrating plate or a stationary bike. So other things that I also do when I'm away from home is I always carry my stretching bands, or I believe that's what they're called. So I stretch. And so, or sometimes while watching TV, if I can't be moving too much, standing, I just pretend like I'm walking, stationary walking.
So some sort of movement is
Yes.
really what helps you.
Yes.
I love that you're giving so many different options for people that are listening. Those are different ways that you can move and prioritize, your physical activity and practicing self-care, and all those different ways that you indicated are very, very important. When it comes to mindfulness and relaxation techniques, so those are kind of like the techniques that I like to do more. I know you're more physical, and and not you don't always do those physical activities, but when you can, you do them. For me, mindfulness and relaxation techniques are my go-to. So these are mindfulness, meditation, breathing exercises, things that are going to help me relax my muscles. And all of these techniques, really, what I'm focusing on is relieving my stress, relieving my anxiety, and promoting my emotional balance. And what do I mean by this? So, a couple of things that I do. So, everyone that knows me, I like to talk a lot, right? I like to talk a lot. And that means because my brain is always working on different things. So I could be here right now, but also focusing on what I'm going to do after right now, after I finish this podcast, what I'm going to do tomorrow, where my daughters are at. I mean, my brain goes a million miles. And the only way that I can actually, release that stress is by calming my body. And the way I do it is by breathing techniques. So breathing techniques are a good way for me to relax. So for me, I do the 4-7-8 technique, which I breathe in, counting up to 4. I hold it in, counting up to 7, and then I exhale, counting up to 8. And that's the 4-7-8 technique. So I do that at night. And the way I do it is, obviously I count in my brain, in my head. I don't count out loud. Otherwise my husband would be leaving me in the room by myself. But I do this because I guess the counting helps me focus on the numbers instead of other thoughts that are going a million different directions in my brain. So that actually helps me sleep. Another thing that I do is I like to practice mindfulness, like what we call nature mindfulness. And I learned this technique with our licensed clinical therapist, with Ruth, who also is part of the support groups that we host monthly, and where we incorporate different modalities. So I learned that going outside barefoot helped me feel grounded. Just feeling the grass, right? I was using my senses, the touch senses, feeling, touching the ground, smelling. I was smelling the flowers. And, I know it sounds kind of, cliche, like stop and smell the flowers, but really do that, because that helps you focus and practice mindfulness. You're stopping, you're focusing on the scent, you're thinking about what it smells like. You're only focused on that moment and that thing. So looking at flowers, feeling the air, just listening to the birds, like all of that is mindfulness. And that's what I like to use. I like to go outside, and even though I don't have a green thumb, I love nature, and that keeps me grounded. And that's one of the things that I like to do.
See, and that's something that I always love to continue and repeat, that we're all different, not because that's helping you means that it's going to help me. I can tell you, I am not one to stop and smell the flowers. To me, I wouldn't be able to do that. So we're all different. You as a patient, you have to find what works for you, what helps you. So yes, Estela, she loves to smell the flowers. I can't do that.
You'll rather plant the flowers.
I'd rather plant the flowers. Yes. And again, you have to find your own way of doing something that's going to help you. I can do yoga. Stella wouldn't be able to do yoga.
I should tell you.
Might relax me. That's not going to relax her.
Clip number 2 we have from episode 102 from October of 2024, and it's titled Navigating the Patient Journey from Early Diagnosis to Remission. In this episode, I am joined by our co-host and AiArthritis Community Awareness Assistant, Eileen Davidson, or known online as Chronic Eileen. And we talk about a patient-infused solution that we've been working on throughout the second half of the year. It is a section on our AiArthritis website called The Patient Journey, and it is a way for the AiArthritis community to find valuable resources for whatever specific part of the disease journey they are in or part of.
Sometimes it can be hard to know, like, hey, this new symptom popped up. Where could it be from? What kind of treatment do I need for those? So that's, what I would also be looking at, as well as I've been in clinical remission for lupus nephritis for the past 3 to 4 years, but my SLE, like my regular systemic lupus, is still active, but under control with medications. A lot of my blood markers have gotten a little bit better, but still not to the point where I'm in full remission for my lupus in general. So still looking to see where I can go to, get on that remission journey. So we'll see how, that goes in the next few years. How about you, Eileen? Where are you in your patient journey?
I would say that personally, I'm on the road to remission again. It is common for when we are on remission to sometimes fall out of it for a variety of reasons. So yeah, the road to remission is where I'm at in my journey. And disease management, of course, we always have to figure out how to navigate living with our diseases, especially as they progress over time. We maybe used to do something that no longer works, so we have to find new self-care or management. But also, I would say that all of the stages in the journey are useful to me as somebody who is on social media. I get lots of patients who message me about, seeking what their diagnosis might be, or they're newly diagnosed. They're trying to understand why they have more than one form of AiArthritis or arthritis, starting to understand, how they can better communicate with their support network. So all the different stages in the patient journey are useful in so many different ways.
I totally agree. I didn't even think about that part of, even with me on social media, I've been maybe about a year on social media, specifically TikTok. And so I've gotten a few different people asking me, hey, like my, in-law thinks that I might have lupus. Like, how do I go about navigating that? And I'm like, oh, it's a lot, but I hope, we do have some resources. And so I was able to send her our mystery patient guidance that we have, which we are consistently trying to make sure that we update and make it the best it can be. There's a few episodes in the past that we've talked about this mystery patient phenomenon that is we really focus on here at AiArthritis. So that's really important to be able to give some guidance to people, because since we are an umbrella organization that has 22 different diseases that may have similar symptoms. So I think that us focusing on the undiagnosed or the mystery patient really kind of is cohesive and makes sense, since we do deal with a lot of these different diseases that have similar symptoms. So I think that us, reaching out to the mystery patient, to the undiagnosed, even if they don't end up having an AiArthritis disease, we can help them rule out AiArthritis diseases and kind of still help them along their patient journey. So anybody, we really do hope that if you're undiagnosed and, looking for a diagnosis, our resources can help you to guide you in the right direction, or even give you some help with how to speak with your doctors, how to, bring up these tough conversations when you are in this process. It can feel really lonely. So that's what we really want to do, is just help everybody along their different stages of the journey.
Mm-hmm. I agree. What do you think your next stage of the journey will be?
I hope it's going to be remission. I've been hearing a lot about really cool new treatments in the lupus space, CAR T therapy that is possibly going to be putting a lot more patients into remission. So it's amazing what research and what new therapies are coming out on the horizon. So that's what I'm hoping, is that I push myself into full remission sometime in the near future. How about you?
Yeah. I that's same for me, and I think it's important that we know that these patient journeys, while it's evolving for the patients, they're also evolving for us at AI Arthritis as we develop them, as new research comes out, new treatments and information.
Yeah, I mean, it's definitely hard to keep up with sometimes, but it makes it really fun and unique for us to be making resources as this new research comes out. There's always light bulbs and aha moments popping up when it comes to us going to these different conferences, when it, leading back to the patient journey and all of the resources that we develop. And so actually, a lot of the resources that we develop come from our Go With Us program that's been going on in the past maybe 3-4 years. That's where we as patients go to these scientific conferences and let other patients know about the new research that's coming out and how it might affect their patient journey. So there's another kind of plug of other resources that we have for you to all look at. If you're more interested in text resources, you can check out our blog that has a lot of resources on there, or you can check out our different playlists on YouTube that have our Go With Us program videos. So those are all very complementary in the patient journey. So,
Yeah. And also, just to pop in and say about that, is under each category of patient journey, we have gone through and selected the works, the blog posts, and the podcast episodes that apply best to that part of the patient journey. So it's nicely neat and organized for you.
Yeah, absolutely. And, some of our resources, they may, double for each of these different journey pieces as well. So some resources may be good for undiagnosed and newly diagnosed, or so on and so forth. So I'm super interested to see, how this goes along. And, we'll talk a little bit more about the different, we kind of talked about the mystery patient and why we separated it that way. We can go into a little bit about newly diagnosed and why this was a really important section for us to make sure that we highlight as well.
Yeah, I think being at the newly diagnosed stage is probably one of the most confusing and drastic times. You could be really stuck in the grief process, or just wanting to understand your disease better, or find, other people who know what you're going through. So the newly diagnosed section is one that I think is very important and covers a number of things. That podcast episodes can talk about how you can tell other people about your disease, or a positive mindset can improve pain and resilience, or how people are often young and living with an invisible disease. So there's a number of resources on there that can help anybody at however they're feeling when they're newly diagnosed.
Absolutely. And I think one of the biggest things is that we've seen a lot of the pharma companies that we speak with focusing a lot on early diagnosis and that newly diagnosed stage, because we've seen a lot of research come up saying that the earlier you diagnose, the earlier you get treatment, the more positive outcomes that you can have and the higher chance of getting yourself into remission. And for a lot of people that are listening to this, that might be kind of discouraging. Like, see, I knew that I should have been able to get that diagnosis. Like, I was waiting for 5, 10, somewhat years to get it. And, I ended up here with my disease progressing so much, and all of these different comorbidities or issues that might pop up because of the uncontrolled inflammation. And so just really seeing that people are starting to emphasize this part, even us as already diagnosed patients, I feel just hopeful for the new generation coming in that are getting these diagnoses, that they won't have to go through a lot of the unfortunate things that us that might have been diagnosed 10, 15, 20, 30 years ago are still living with and kind of dealing with at this point in our journeys. But seeing the hope for those newly diagnosed patients, even though it might seem very morbid and very sad when you first get the diagnosis, knowing that technology and research has evolved so much and there's so much on the forefront available is really kind of inspiring for me, even still, like, as living with the disease.
Absolutely. You can also find, support on asking yourself, who are you now? That's a real big one when you have a diagnosis. There's losses that'll happen when we get newly diagnosed. So there's a resource on that or the support tool. Would you like to walk us through the support tool, Leila?
Yeah. So the support tool was actually also developed from a talk show episode where two siblings talked about how, even the people who support those with the disease need support as well, and what they need in order to give you the most support that you can have. And so these are conversations that you can have with anybody in your life that you may be talking to about your disease, but it kind of just guides you through that conversation and what questions that you can ask that you might not have thought of before. So checking out that support tool can be a really good conversation starter. Even if you don't fill the full thing out, just checking it out to see the different conversations that could be had would be a really good idea for not just the newly diagnosed, but any stage of the journey. It would be a really good tool to check out.
Yeah, a lot of the resources do overlap with different stages. So we could go through each one individually, or you can check them all out yourself.
Absolutely. And I think that, like we said, disease management is a really big thing no matter what stage you're in. And so that's kind of the biggest section that we do plan on filling out and getting a lot of resources for, because it does, go along the spectrum of the patient journey. So a lot of things like we have cardiovascular involvement when it comes to AiArthritis diseases, information on exercise and diet, even brain fog, like we've been talking about, that can be one of the most frustrating of our symptoms to deal with.
Absolutely. And we have the American College of Rheumatology conference coming up. So we'll be able to update all of these resources with new information. Granted, there is new information on it at the conference.
Absolutely. We both talked about working towards remission and what that means, and how we do plan on making sure that we disseminate the information whenever we get it from those conferences. And so we have been hearing a little bit more about remission at these conferences. It wasn't really a topic before the past 2-3 years. So I think that just knowing that is, again, really inspiring and giving us a lot of things to make resources on and to get that information to patients. Because if people aren't in the research space and aren't, privy to all of these new things that are coming along, then people may not feel the inspiration or like kind of the positive outlook of what's on the horizon if they have no idea that these things are coming out.
Yeah, and I think it's really important for those with AiArthritis diseases to understand what remission is, because remission is not a cure. It is low or no disease activity for an extended period of time. Definition of it gets a little confusing, so it's really good to educate yourself on that one.
Lastly, our number one listened to episode this year is episode 93 from January, Reproductive Health and AiArthritis Diseases. In this episode, I discuss how AiArthritis diseases can affect reproductive health and important things to know about. And I even touch on my own reproductive health journey. Specifically, if you have any of the more rare AiArthritis diseases, I'd love to hear any stories from that sector of our community. We do hear a lot about lupus, rheumatoid arthritis, psoriatic arthritis, axSpA, and all of those main diseases that we do have. But I would love to hear more from the other side of the community too, if there's anybody else that has any stories or insight about reproductive health. Alrighty, well, let's get into it. I'm going to be talking first about reproductive health in general. I wanted to make sure that I do talk a little bit about men or males in this situation with AiArthritis diseases, because they can affect their reproductive health too. So I'll talk a little bit about that. And if there's any more insight that you all have, again, please let me know. But the first thing will be puberty can be delayed with an AiArthritis disease. And this can be due to steroid use or disease activity, but it can affect bone growth and height and, starting puberty later in life. So that's something that does happen with AiArthritis diseases. And some females can get increased disease activity with menstrual periods. So there has been a lot of studies checking with the levels of hormones during menstrual periods and seeing the correlation between that and the flares that come with menstrual periods. And so that is something to also be aware of. I'm sure everybody knows this, but unplanned pregnancy can cause severe health complications for both baby and mom. So making sure that precautions are being taken in order to make sure that that doesn't happen and cause, all those complications. One of the things that can be used is birth control. Birth control is a good tool, one for helping those who may have severe menstrual periods and have a lot of trouble getting through the day when they have their menstrual periods. It can help decrease the amount of pain and suffering that someone might go through during their period, but therefore also can help with decreasing the chance of flares during that period too. And so not all birth controls are created equal. Not all birth controls are recommended for those with AiArthritis diseases. Of course, like with any advice that we are sharing or any research that we are sharing, this is not an end all be all. Make sure that you have a conversation with your rheumatologist, your gynecologist, your family practice doctor to see what's best for you. The research does say, though, that the safest forms of birth control are IUD or implant or the mini pill. And that is because estrogen is not recommended for high-risk patients because of the risk of blood clots. So the other forms of birth control are mainly estrogen-based. So that's a big thing to keep in mind. The IUD is something that can be a long-term birth control option. It's a implanted device. It's actually called an intrauterine device. That's what IUD stands for. It's a little T-shaped little doohickey that's about like this big, that is inserted into your uterus in order to block an embryo from being implanted. Or also, if there's a copper version and a hormone version, a plastic version. So the hormone plastic version also secretes hormones that can help to thicken your uterine lining to prevent pregnancy. And the copper version, copper is a spermicide. So it kills sperm that come in contact with it. And also both can, prevent the implantation of the embryo inside the uterus. The birth control implant is a rod about this big and it's a very thin, it's maybe about this thin, that goes into your arm. I don't know if I can even, I don't know if I'd be able to show this to you on screen, but this is where my implant is. It's about this big. So you can kind of see where I'm showing it, and it's very thin. This is my third or fourth one of them, but so that's the implant. The implant is put in as if it was just like a shot. So it's kind of like they put a device on you and kind of shoot in the little implant. And this is like the spot where it usually goes is like on the inside of the arm or on the bottom of the arm so that it's, kind of not in the way and not detectable. It also may even stop people from having periods. So it really just depends on each personal situation, but that can also happen. And that's what happened to me for most of the time, is that I did not have a period for most of the time that I've been on it. And the last version that is recommended is the mini pill, which is kind of a lower dose, regular pill of birth control, but estrogen is not included. So it's just the progesterone. And estrogen is, again, not recommended for those that are high-risk patients. So that's something to keep in mind. Every situation is different. Those with lower disease activity can have a bigger choice pool of what kind of birth control that they prefer. This also has to do with med compliance and how the patient is with taking pills and making sure to remember to take those pills. That's why I got the implant, is because I did not want to have to remember to take a pill at the same time every single day, additional to all of the other lupus medications that I have to take. So that was kind of my reasoning, but every single person has their own preference with all of the different types of birth controls. There is a really great chart on lupuspregnancy.org, which was mentioned in our previous episodes also, that you can go check out on their website and see all the other recommendations that they have. It's a really great resource. As I'm talking about the previous episodes, I think I forgot to mention them. So I wanted to make sure that we do have 2 other episodes that are about reproductive health. We have episode 11, which is called Oh Mama, Pregnancy Planning with a Chronic Illness, and episode 51, which is Oh Mama, Physical and Emotional Support Postpartum. So that one is a little bit more about breastfeeding and all of the other things that might happen after giving birth and how those around you can support you if you are a new mom with AiArthritis diseases. So please check out those episodes that have amazing guests from Mother to Baby, another resource that I will mention a little later, and from Mamas Forward, which is Mariah Leach, who is on both of those episodes. She is a really big advocate in our community for reproductive health and helping moms through the journey of becoming a mom. So check out those previous episodes. And I wanted to make sure that I didn't, kind of cover the same thing. So that's why I'm talking to you about those episodes. So if there's anything that you might be wondering more about reproductive health, may be in those episodes. So definitely please go check those out after this. Okay, on to the next section that I wanted to talk about is about fertility and medication and how medication can affect fertility and things like that. So as we spoke before, there are medications that also can not be safe for babies when the mother is pregnant. So a lot of mothers may think that you need to stop all of your medications in order to have a healthy pregnancy for that baby. And that is just untrue. There are medications that you can be on to help control your disease that will not affect the baby or pass the barrier and be passed on to the baby and affect them. So again, that is a really big conversation to have with your own rheumatologist and gynecologist, and having a collaborative team. There are specific doctors, gynecologists that are for more high-risk patients. So having a team of a high-risk gynecologist and your personal rheumatologist that knows your story is really important to, continuing that on. I did mention, again, that's talked a little bit more about, the medications to be safe, the medications to look for, and all of that kind of stuff is more in the previous episodes and on Mother to Baby. So make sure, if you want to look specifically for your AiArthritis disease and the medications that are commonly used for that disease, and check it out and see which medications are deemed to be safe and which medications are deemed to be not safe and which medications are kind of in the middle of being studied. So yeah, make sure to check those resources out. Okay, so I wanted to talk about medications that can affect fertility. So with the medications having to do with fertility, there's one medication in particular that I saw over and over again that was deemed to really affect fertility in AiArthritis patients is cyclophosphamide. Really depending on the dose, there's like a threshold of how high the dose would be in order to really cause infertility. And that can also depend on age. So if somebody is on cyclophosphamide and is needed to help control their disease, it's recommended that you preserve your sperm or egg. You would first have to go, maybe a few weeks or whatever it might take without the medication in order to have safe eggs and sperm to freeze. But that is something that is recommended. And then once, you freeze the sperm or the egg and go back on that medication for the time being until, if you're a woman, if you have to get pregnant. For males, you don't really have to worry about it anymore because the sperm is frozen. So that's a good thing. Thank you so much for listening to AiArthritis Voices 360 this year. We hope that this show can continue to help bring peer education to the AiArthritis community in 2025, as well as be a place where our fellow patients can come, listen, and feel less alone and a sense of community. This show would not be possible without the generous support of our community. So if you enjoyed this episode, please consider making a donation at www.aiarthritis.org/donate. And thank you to our partners at Bristol Myers Squibb for their continued support of our show.
AI Arthritis Voices 360 is produced by the International Foundation for Autoimmune and Autoinflammatory Arthritis. Find us on the web at www.aiarthritis.org. Also, be sure to subscribe to this podcast and stay up to date on all the latest AI arthritis news and events.